Senator from Louisiana.
Madam President, I'm going to try and present a way forward for Democrats, Republicans, and Americans out of our current situation with a different proposal than people have already thought of. Now, the government should have been shut down for 38 days, and tomorrow we're going to vote again, and tomorrow the vote will again fail. But in Americans, Congress is frustrated. We need to open the government. So, if to open the government we need to talk about health care, let's talk about health care. Let's have a conversation in the family. We have an affordability crisis, and health insurance is part of it. Now, this is personal to me. I'm a doctor, practiced in a hospital for the uninsured and the poorly insured for 20 years. And many of those people that came to see me were middle-income Americans who could not afford their medical bills and could not afford insurance. I want to see this solved. But if we're going to solve it now in this present circumstance, we need to move beyond entrenched ways of thinking that have settled us in our camps and refuse to allow us to listen to the other person. And I thank some of my Democratic colleagues for being here. We've got to be creative. Now, the Affordable Care Act, Obamacare, whatever you want to call it, tried to make health care affordable by giving insurance companies more money. The enhanced premium tax credits, EPTC, is the latest example. Next year it would send $26 billion to insurers, hoping that families see smaller bills. But that actually doesn't make health care less expensive. And for some, it actually makes the health insurance more expensive if you're not getting subsidized care on the exchange. So we can do better than just papering over the cost with subsidies. Instead of paying insurance companies to manage our money, let's trust Americans with a pre-funded, flexible savings account worth as much as the enhanced premium tax credit that they would receive. Let me repeat that. A pre-funded, not out of their salary, but pre-funded from the federal taxpayer, equivalent in value to the enhanced premium tax credit that they would receive. Now, let me make it clear. I'm not speaking for the Republican caucus. I'm not speaking for President Trump. I'm not even speaking as the Help Committee chairman. I'm speaking as a senator and as an American that sees us at an impasse and is trying to think differently about how we can move forward. So, I'm going to present to my fellow Americans an idea that hopefully will move us out of this stalemate and go forward. And I'm going to try and speak as if I'm speaking to the American back home. Here's the problem. Under the enhanced premium tax credit, if your insurance premium goes up, if the insurance company decides to pay more, they just get more subsidy from the taxpayer. Now, insurance companies get paid no matter what, and it doesn't matter how expensive the tab is. There's absolutely no incentive to bring the cost down. There's no transparency as to what the care really costs, and there is absolutely no reward for the family that goes to a place which is less expensive. It's like putting a Band-Aid on a broken bone. You're hiding the fracture, but you're not fixing the broken bone. Let's fix the broken bone, which is high health care costs. So, put simply, the enhanced premium tax credit does not empower patients. It enriches insurance companies. By the way, they're important. We need them. But if I have a choice of empowering you, the American, or enriching an insurance company, I and we should pick our fellow American. Now, imagine a different type of help. Not paying the insurance company another subsidy, but putting money pre-funded, not out of your salary, but roughly equal to the enhanced premium tax credit, put that into an account that you control. Every eligible American citizen on the exchange would receive this federally pre-funded flexible spending account. And it would work like the prepaid health account you use for real-world health expenses. It would actually have more flexibility than your current insurance proposal. You go to the dentist, it can pay for dental care. You go to the orthodontist, it can pay for your orthodontal care. It can pay for eyeglasses, which typically insurance does not pay for. Prescription drugs, medical supplies, your deductible, your copay, it can pay for it all. Now, it wouldn't pay for insurance premiums. This is about you spending directly for your health care costs, not about enriching insurance companies. It would pay for the care that families actually use. That's what a pre-funded flexible spending account actually does. I keep emphasizing pre, because I mention this to people, and they say, wait a second, this has to come out of my salary. No, this would be the money that would go to an enhanced premium tax credit, and instead it goes into this account that you control. Now, it seems complicated for some. I go and I mention it to them. I say, oh, boy, this is something different, Bill. This is a great idea, but, it's kind of like, just too different. 72% of Americans getting their health care through some government entity are offered flexible savings accounts. 47% of people getting insurance through their employer are offered FSAs. This is something that is used by millions of Americans already. So what I'm proposing is just to give this option to people on the exchanges. And by the way, the federal government already offers flexible savings accounts to people on these small business exchanges. Members of Congress, we are on the Obamacare Small Business Exchange. We have the option of choosing an FSA. My family has one. And the Department of Treasury already has an office through which they funnel money to pay for these flexible spending accounts that I, as an individual, choose to get. So what we're speaking of is just offering to people on the exchanges, that on the individual exchange, that which is already offered to people on the small business exchange, and paying for it by the same mechanism in which it's already done through that exchange. Now, still, there's going to be some bureaucracy involved. But if there's any president that can overcome the inertia of the bureaucracy to make it happen by January 1, 2026, is Donald J. Trump. Donald Trump is the man who, when it was told it would take 18 years, 10 years, 18 months to come up with a vaccine and a program to prevent COVID transmission, he did it in 10 to 11 months. This president can overcome the inertia, and we have a running start because the federal government is already doing this. Now, let me make clear the key differences between enhanced premium tax credits and federally funded flexible spending accounts. First, who gets the money? Under the enhanced premium tax credit, insurance companies. Under this, it is patients and families. What can it be used for? Here, the premium tax credits go for insurance premiums. Period, stop, full stop, boom, it goes to the insurance company. Here, real care. Your doctor visit, your deductible, your copay, your dentist, your glasses, your prescriptions, that sort of thing. Who makes the decision? The insurance company. Just wait and fight with them about a pre-authorization. Under the flexible spending account, you make the decision. You have the power. And lastly, does it lower cost? No. It is pretty clear if we continue to fund insurance companies no matter what they pay, it drives up the cost. In contrast, if you empower the patient, that mother is going to find the most affordable option. It's been studied. If you give people something that they perceive as their own money, they hunt for that bargain. By the way, if they go and they find out that the cash price is cheaper than what the insurance company would charge them, they will have the option of using this for the cash price. So we have reforms in here that give the patient even more power. Good thing about that, as the patient saves money, so does the taxpayer, and that's a good thing. So the pre-funded flexible spending account doesn't treat people like dependents of the government, as do the enhanced premium tax credits. It treats you like a capable consumer who knows what is best for your family. You decide where to go for dental work. You decide your pharmacy. You decide whether to pay the cash price or the negotiated price that the insurance company offers you. And instead of Washington paying insurance companies to manage your day-to-day care, you manage it with fairness, transparency, and flexibility. Now, some will ask, won't this cost money? Of course. In the first year, it'll be about the same amount as the enhanced premium tax credit. And my Democratic colleagues should like that. But the individual would be getting better value through the federally pre-funded FSA, because she is spending it on that which she actually needs, as opposed to up to 20% of it going for overhead, profit, and administrative cost. It isn't just fiscally responsible, it's common sense. Who wouldn't rather have their money in their own pocket than for the insurance company to dictate how they spend it? So here's the choice before us. In conclusion, we can keep paying insurance companies to paper over the higher cost behind confusing bills in a system which actually raises the cost for some, or we can give Americans the tools, we can trust our fellow Americans to pay for their care directly at fair prices with transparency. If you will, it puts patients first, not insurers. It encourages competition, it rewards smart choices, and it begins to make health care truly affordable, not by inflating subsidies, but by unleashing the power of the consumer. Let's stop writing blank checks to insurance companies. Let's invest in our fellow Americans. I say this, we have to first open the government. This takes writing some legislation. We have to open the government. But we have to be willing to take a risk to solve a problem and not be afraid to do something different. I have seen in our chamber right now a hunkering down. We've not been able to solve it, so we're not going to try anything different. We're just going to wear the other side down until they wave the white flag. Now is the time to be creative. I'm a rock-rib Republican, but I will say what I just offered is not a Republican solution. It is not a Democratic solution. It is an American solution. Let's open the government. Let's work together. Let's fix health care by giving the American more power, not the insurance company. Thank you.
Senator
A question?
from Washington. Without objection.
Thank you. Will my colleague yield for a question? Absolutely. Thank you. I noticed in your proposal, you're talking about something that you would hope to affect January of next year. Is that correct?
That is the goal, to have this ready for next year.
What is the senator from Louisiana's interpretation of how the market controls the, you're trying to create a market mechanism where you're giving the consumer the same amount of money you would give them in the tax credits to make the insurance more affordable only through a health savings account. But how do you know once you gave that in the health savings account, the market is going to not still have an increase above that amount? So how do you think this affects the market?
Wonderful question. First, this is a flexible savings account, not a health savings account. There is a legal distinction. I want to make that. When the enhanced premium tax credits are not renewed, we know the insurance companies have already set up their rates. And so the consumer, our fellow American, will be choosing from the offerings that have been made by the insurance company for them to choose from. The difference would be, and they will see, by the way, that the policy for someone at 400% of federal poverty level costs about $2,500 more a year than it otherwise would have with the enhanced premium tax credit. This would be supplemental. We would say to that individual, you're at 400% of federal poverty level. Your policy is $2,500 more a year. You will get a flexible spending account pre-funded to help offset the cost of this. Now, if it's my family, I would say, I got $2,500. Maybe instead of going for a silver plan, I'll go for a bronze plan, because now I can offset the higher deductible with my flexible savings account. And because I'm going for a bronze plan, my premium will be lower. But that's trusting the American people. We are plugging into the current insurance market. We're actually not changing at all how it functions.
Would yield for another question. I'm assuming that you think affordability is the key. I certainly think affordability is the key. Nobody wants to subsidize expensive health insurance. We want to create market mechanisms to drive down the cost of health insurance, not just spend money to buy expensive insurance, whether you buy it through the tax credit or buy it through a health savings account. We want to create those mechanisms. So again, all of this is going to take place in November and December, right now and December. So somehow you would make some calculation in January about what would go into a savings account, or you're thinking of a flat number?
That's a wonderful question. No. If somebody, the federal government knows, or put it this way, many states have calculated what would be the insurance rate with an enhanced premium tax credit and what will the insurance rate be without the enhanced premium tax credit. It has been calculated for our fellow Americans what the value of an enhanced premium tax credit would be if they signed up for a certain policy in their state, given their age and their health condition. They know that. The question is whether they get the credit or not. Well, they're not going to get it, so the policy is going to be higher. And this, under the plan, if we can agree to it, they would then get the FSA in an amount equivalent to that which they did not receive as a payment to the insurance company. Instead, it would be a payment to the flexible savings account they would have, and that they would then use it for these services.
If the senator would continue to yield, the issue is that, you know, so much of this is already set up, and I think you're trying to be creative in a way to, instead of the Alexander Murray cost revenue sharing, I think you're trying to figure out something that would get people the same amount of money to make them whole over the next year or two. Is that correct?
That is correct.
So I would say what we're trying to do is make people, as the market is out there, whole over the next year or two. That's exactly what we're trying to do. We're happy to debate how we make health insurance more affordable after that. That has been a goal of our side of the aisle for decades. We want to make it more affordable. Now, we all get to be measured about how successful we've been on that, but I think that we're going to continue to strive to make it more affordable, and really are proud that we drove down the uninsured rate with the Affordable Care Act, because we covered more people, thereby lowering costs because not having so much uncompensated care. So I'm glad to see somebody saying, let's talk and let's put a proposal out there. Happy to continue to have a dialogue about any idea that helps us move forward. But the issue is that so many Americans are in this moment right now making these decisions, and how you affect that for the next 2 years is the biggest question. And you and I know if we said, okay, we're huddling tomorrow, or the finance committee is huddling tomorrow, then everybody would be up here trying to convince us not to do various things. So the question is, how can we protect the marketplace for the next year or two in the simplest way, and then get about us going back to business, talking to each other, trying to work out what are the best creative ideas for lowering health insurance costs. I don't know why we haven't done a PBM bill. I mean, my colleague Senator Grassley and I have a bill. I think you have a proposal. Other people have a proposal. We're letting PBMs get away with so much in the expense of prescription drugs. I don't know why we don't spend all our time driving down the cost of health insurance. So I'm happy to work creatively on ways to protect the market over the next 2 years so that we can finally get to some creative discussion. So I thank the senator.
Thank you for the questions, and let me just respond very quickly. I think the beauty of what I'm proposing is it fits in very nicely with the insurance markets as they currently are. It doesn't require anything to change between now and January the 1st. It is too late to change those plans and those rates. It is just too late. This does not require those rates to change. This would be something which could benefit our fellow Americans next year and could be implemented by then. Yes, the bureaucracy is going to have to work hard. President Trump can get them to work hard. You mentioned several other reforms. I am in total agreement. We should be working, again, Democrats, Republicans, that's what we need to do to get something done, in order to come together for a set of proposals that will lower health care costs. And both as a member of the committee, we both serve on Senate Finance, as well as the chairman of the Health Committee, it is my intent to do that. We've got to do that. But this can work this year for Americans who are going to be on the exchanges, and that's my hope. With that, I yield. Thank you.